In our natural remedies seminar, we're going to be looking at poultices and compresses. And the first one we're going to look at is castor oil compresses. It's not a poultice, it's a compress. Castor oil penetrates deeper than any other oil, and wherever it penetrates it can break up lumps, bumps, adhesions. So great for cysts in the breast, for breast cancer, great for irritable bowel, great for constipation. It's very good at breaking up stones in the gallbladder, kidney stones, bone spurs. If the bone spur has been there 3 years, it might take 3 months. If the bone spur's been there 3 months, it might take 3 weeks. Little by little, the body heals, so be patient.
Dr. Barbara O'Neill, an Australian naturopath, has become a polarizing figure in the world of alternative medicine. Banned from practicing by the New South Wales Healthcare Complaints Commission in 2019, her methods and claims have sparked widespread debate about the efficacy and safety of alternative health practices. This exploration delves into 7 of her most controversial healing methods, examining their implications on public health and individual choice. One of O'Neill's most notorious claims is that sodium bicarbonate can cure cancer. She suggests that cancer is caused by fungal infections and can be treated effectively with baking soda. This assertion is unsupported by scientific evidence and dangerous, as they encourage patients to form conventional treatments like chemotherapy. The HCCC found that she misled vulnerable patients by promoting this unproven method, potentially leading to severe health consequences for those who might reject effective medical treatments in favor of her advice.
So you've got to give it time to soak through. I haven't covered it because then there's no leeway for the excess oil to go. And also when it goes on your hot body, the oil will thin and spread out a little bit more. So you want to give a little bit of room for spreading. This compress can be used maybe every day for a month. And then you might make another one, because it's not drawing anything out of you. It's just a vehicle to hold the oil so it can go into you. And this size I've made here, that's a great size for chest, for congested chest. That's a great size for abdomen. And that could be cysts on the ovaries, it could be fibroids in the uterus, it could be constipation, it could be irritable bowel. So that's a nice size for those areas. How long would it take? Well, it depends how big it is and it depends how long it has been there. Consistency is the key. The second thing I'm going to look at is the humble onion. Now, the onion can be used cooked or it can be used raw. To use it cooked, we'll look at cooked first, and this is the first poultice that I ever did. My first daughter, I was 23 when she was born, so I think I was probably about 25 when she got an earache. And I was trained as a nurse. Even though I was a bit of a hippie and starting to grow my own veggies and all that sort of stuff, I didn't know what to do about an earache. And everyone said to me, "Don't play with the ears, she could go deaf." So it was really out of fear and lack of knowledge. I went to the doctor. He wrote her a script of antibiotics. I gave her the antibiotics, I didn't know what else to do. Within 24 hours, the earache had eased. When she'd finished the antibiotics, the earache came back. I did not know what to do. 6 weeks later, and 4 courses of antibiotics later, the earache comes back. But I still don't know what to do. So when I went to the doctor, I said, will my daughter be on antibiotics for the rest of her life?
O'Neill has also gained notoriety for her anti-vaccination stance. She claims that vaccines are harmful and suggests that children could be naturally vaccinated against diseases like tendinitis through lifestyle choices, rather than immunization. This position contradicts established medical science and poses a significant risk to public health by potentially increasing the incidence of preventable diseases. Critics argue that such views contribute to vaccine hesitancy, undermining herd immunity and endangering community wealth. In a particularly alarming recommendation, O'Neill advises patients to feed infants unpasteurized goat milk as a substitute for breast milk or formula. This practice is widely condemned by health professionals due to the risk of serious infections and nutritional deficiencies associated with unpasteurized dairy products. The HCCC's investigation highlighted this advice as not only misleading, but potentially life-threatening, especially for vulnerable infants.
And what I'm going to do now might surprise you. I'm going to put the onion on the bottom of the feet. So why do we put the onion on the bottom of the feet? We put the onion on the bottom of the feet because the bottom of the feet, or the feet I should say, are a reflex for the chest. And we're going to put the onion on the bottom of the feet for if someone has a bad cough in the night. And I'm going to use a plastic bag. Now at Misty Mountain we buy boxes of starch bags, so they're made out of starch, and that would be the best. Now if you don't have starch bags, you can certainly use a cloth. So you might use a cloth, put the onion like that and put it in the bag, and then what you do is you put your foot on the onion like that, and then you twist it around and put a sock on. So the bottom of the feet is touching the onion, and then you put a sock on and it holds it in place. Now my grandson, he was 3 at the time, I was visiting my daughter and he had a bad cough, and she gave him a hot bath, which always eases the cough, and put him to bed, and he was coughing and coughing and coughing and coughing. And we thought he'll be asleep in a minute, but he kept coughing and coughing. So after half an hour I said to Em, let's do the onion. So we got him up, we chopped up an onion and put half the onion chopped up on one foot and half on the other foot, and put him to bed. Not one more cough. It's almost unbelievable. You almost have to do it to believe how incredible it is. Not one more cough for the whole night with the onion on the bottom of his feet. So that's great for a night cough.
O'Neill expresses skepticism about the use of antibiotics, claiming that they're overprescribed and contribute to antibiotic resistance. While there is merit in discussing antibiotic stewardship, her blanket discouragement of antibiotics, especially in cases where they are medically necessary, can lead to dire consequences. For example, her advice against administering antibiotics for group B streptococcus during pregnancy could significantly increase risk for both mothers and newborns. Another controversial aspect of O'Neill's practice involves detoxification protocols that lack scientific backing. She advocates for various detox diets and cleanses, claiming that they can cure ailments ranging from chronic fatigue to cancer. Such detox methods often rely on restrictive diets or unproven supplements, which can lead to nutrient deficiencies and other health issues, rather than the purported benefits. Critics argue that these protocols are more about marketing than genuine health improvement.
Cayenne pepper. Cayenne pepper, we've got cayenne pepper in this little container here. Cayenne pepper is a remarkable herb. Some people say we shouldn't use it because it's a stimulant. It is not a stimulant like caffeine or alcohol or marijuana is a stimulant. It's a blood stimulant. That means it's good because Leviticus 17:11 states that the life of the flesh is in the blood. So anything that moves blood is going to be helpful. There's a book you can get. It's by Sam Beiser. It's called Curing with Cayenne. And he shows in that book that you put cayenne with any other herb and it'll intensify that other herb's action. It's a blood stimulant. It can be used internally and it can be used externally. And I think in your book it shows how it does 3 main things internally in the blood. It thins the blood, it strengthens the arterial walls, and it opens the capillaries. So let me tell you about an experience I had a few years ago. It was one of our retreats. I got the call, lady'd had a heart attack. I was only 3 minutes away, that's why you have to be fit. I ran down, it was a cooking class with about 16 people, and she was lying on the floor. She was 80. Her husband said she'd already had a few that year, and they always called the ambulance, but they thought, let's see what they do. And I said to my offsider, cayenne pepper, quickly. We got the cayenne pepper. Now there was a guy holding a pulse and he said the pulse is almost gone. She was just white. So I don't know how much I got. You're just in a hurry. So I think I got about half a teaspoon, put it straight in her mouth. She was half conscious, gave her a little bit of water to drink. And the guy holding the pulse yelled out, the pulse is strong. This would have been 2 minutes. And you could feel that pulse come back and all the blood came back to her face. She sat up and said, what happened? Everyone around was going, Whoa. And I said, no, it's not me, it's the cayenne pepper. So we sold out of cayenne pepper that program. What did the cayenne pepper do? It thinned the blood, it opened the capillaries and got a dramatic delivery of blood through the whole body. Remember, 1 minute for 1 drop of blood to go around your whole body. I have read about it, but then I actually experienced it. So cayenne pepper can also be used to boost hydrochloric acid. You take it in internally, it'll boost digestion. Cayenne pepper can also ease a sore throat. Remember, it's in the flu bomb. It might give it initial tingle, but then when that tingle settles down, it eases it. Some people take or are told to take aspirin for a blood thinner. In fact, I have read where it is recommended that anyone over the age of 50 should be on half an aspirin a day. You might have heard that. Well, what the research is showing today is that aspirin causes stomach bleeds. It's the number 1 cause of stomach ulcers. It causes brain bleeds and eye bleeds. That's what the recent research is showing. Cayenne pepper will not cause that at all. But if cayenne pepper's in your blood and it sees a bleed, it'll constrict the blood vessels to stop the bleeding. Yes, it dilates the blood vessels when it's in the blood, but if it sees a break, it'll constrict that. Beautiful illustration of Psalm 104 verse 14, that God gave herbs for the service of man. Remember? They're there to serve you. Where would you like me? What would you like me to do? Thin that. Seal that. That's the cayenne pepper. In fact, it's just about a first aid kit in one. Is the cayenne pepper, and you'll get used to it.
O'Neill frequently promotes the idea that the body can heal itself given the right conditions, an assertion rooted in holistic philosophy but lacking rigorous scientific validation. While lifestyle changes such as improved diet and exercise can certainly enhance well-being, suggesting that these alone can replace conventional medical treatments is misleading and potentially harmful. The danger lies in patients delaying or avoiding necessary medical interventions based on these claims. Throughout her career, O'Neill has made numerous claims about various health conditions without providing credible evidence to support them. For instance, she has stated that no baby has ever died from Group B strep infection at birth, a claim that contradicts established medical knowledge about the condition's risk. Such misinformation not only misleads patients, but also undermines trust in legitimate healthcare providers.
It's charcoal. Charcoal does not absorb, it adsorbs. What does adsorb mean? Adsorb means that it binds, and it binds poisons. It particularly binds poisons. It binds the poisons to its millions of little facets. So under a microscope, there are all these little facets like this, and it adsorbs poisons by binding them to those facets. It's been known for a long time. NASA filter their water and their air in outer space with charcoal. Many masks have charcoal in them to neutralize the poison. In hospitals they use charcoal to filter the blood for dialysis. And in cases of poisoning, anyone who's worked in casualty knows that they give a dose of charcoal. Because if someone's been poisoned and they take charcoal, the charcoal will adsorb and bind that poison to its facets, and it's basically safe until it gets out of the body. So internally it can be used for any case of poisoning, and it can also be used for diarrhea or vomiting. Many people that go to Asia always travel with charcoal tablets because if they get rid of what's called barley belly or diarrhea, they'll take the charcoal. You can also use charcoal on the outside, and it can be used for bee stings, spider bites, snake bites, wasp bites. It's quite incredible the way once you apply that, the sting comes out almost immediately, or the pain, I should say. Now, it's very messy stuff to work with, so I'm going to show you a mess-free way to make the poultice. And you can make this ahead of time and keep it in the fridge. When you mix charcoal with water, it's like mixing dirt and water. It doesn't mix very well. And so we're going to use psyllium. You can use slippery elm or you can use ground linseed. So we're going to use a teaspoon of psyllium to 2 teaspoons, or this is probably equal to, this spoon is equal to 2 teaspoons. So what we've just done, 2 teaspoons of psyllium to 4 teaspoons of charcoal. You always put the lid straight back on the charcoal because you don't want to drop it. And you seal it while you mix it. So you want to mix that quite nicely. And what we're going to do is put water in there. And then we're going to let that mix or gel together. And we're going to roll it out so it's thin. And you've got a thin, jellied charcoal poultice. So to that you'd probably do about half a cup of water. And you move that around for a while and it'll start to gel. Now the beauty of this is that you'll roll that out, get the air out, and you'll roll it out so it's a strip, a thin strip, and then you put it in the fridge. Or you'd put it in the freezer if you don't think it's going to be used for a while. And then if someone has a bee sting or a spider bite or a snake bite, then you cut a section, cut it round, peel the top off, and it can be slapped straight on. It'll have that plastic topping and you can bandage that on. So it's very, very easy to do.
The case of Dr. Barbara O'Neill raises critical questions about the intersection of personal health choices and public safety. While individuals have the right to explore alternative healing methods, it becomes problematic when those methods lack scientific support or pose a risk to vulnerable populations. The HCCC's decision to ban O'Neill from practicing was based on a thorough investigation into her claims and practices, which found that she posed a risk to public health by disseminating dangerous misinformation. This ban reflects a growing recognition of the need for regulatory oversight in alternative medicine, a field where anecdotal evidence often overshadows empirical research. Supporters of O'Neill's often cite Big Pharma as a primary antagonist in their narrative, arguing that pharmaceutical companies prioritize profits over patients' well-being. While it is true that profit motives can influence healthcare practices, this does not negate the importance of evidence-based medicine. It is essential to critically evaluate both conventional medicine and alternative approaches without falling into conspiracy theories that dismiss legitimate scientific inquiry. Dr. Barbara O'Neill's conventional methods serve as a cautionary tale about the dangers of unregulated health advice. While many individuals seek alternatives to conventional medicine out of frustration or disillusionment with traditional healthcare systems, it is crucial to approach such alternatives with skepticism and an understanding of potential risk. Public health advocates must continue to promote evidence-based practices while respecting individual autonomy and health choices. However, when those choices threaten public safety, particularly among vulnerable populations, regulatory bodies must take action to prevent harm. In navigating the complex landscape of health information today, individuals must be empowered with accurate knowledge and encouraged to seek guidance from qualified healthcare professionals rather than unverified sources promoting dubious claims. The conversation surrounding alternative medicine should prioritize safety, efficacy, and informed decision-making above all else. Thank you for watching. If you enjoyed this video, be sure to smash that like button and subscribe for more exciting content.